Now, South Africa does not have enough ventilators for people in intensive care. This is according to Deloitte's projections for the number of ventilators and the oxygen required until August. But now the South African aerospace and military technology company Denel is mobilizing its expertise to design and develop ventilators for COVID-19 patients. Let's get you the latest on the story now. We're joined by CEO of Denel Dynamics, Sello Ntsihlele, and he joins us via our Zoom line there. Sello, good morning. Thanks very much for your time. So from an arms manufacturing company now to socially necessary work, this is quite a turnaround for Denel.
It is indeed. We thought we couldn't fold our arms while the country was in crisis.
So, Sello, I have to ask, Denel is in a difficult financial position. We know that Denel has been unable to pay salaries this month. We know that wages are in trouble for June and July as well. How does this turnaround fit in with your difficult financial position?
Well, we had strategies in place, but then all the plans that we had were not without risks. So it is indeed difficult for us as a company and our employees. But we think we're engaging our stakeholders. We should be able to have this resolved very soon.
But as it stands, you're still unable to pay salaries for May.
Yes, but we hope that this should be resolved very soon, yes.
So, Sello, will this turnaround of Denel, it now going in with other institutions as well in the production of fit-for-purpose ventilators, will this be a new future for the business model of Denel, more of a focus on the broader social needs of society as opposed to manufacturing weapons of war?
Yes, we think if there's anything to take out of the crisis of COVID-19 was that the companies such as ourselves should be able to diversify the portfolios instead of always doing what we call the sharp points or the weapons of war, as you call them, to consider more social applications, the non-military applications. So it does present a good opportunity for our business.
And just in terms of the kinds of numbers you are aiming for here in the production of ventilators, how far are you now? What's the aim?
Well, we've done with the preliminary designs. The biggest challenge we faced as we get to know this was when we started, we didn't know what we didn't know. But using the engineering expertise we had, we quickly realized if you use the proper engineering expertise with having proper value systems, you will indeed be able to come to a solutions. We have had a prototype that is working. Now the next stage is to develop what we call a Mark 1, a working prototype, which we have designed now. Then we hope that this should be finished in the next 2 to 3 weeks. So starting the month of end June, we should have a few ventilators ready for use, barring regulatory requirements. And I must say the most difficult part was to make sure that we build a certifiable system. Anybody can build what he calls a ventilator. For it to be used on people is another argument. And that we realized was a big challenge. But our focus has been to build a certifiable system, and we think we are in the right track.
And this certifiable system, I'm reading here, is also being manufactured at a lower cost. What kind of saving are we talking about here?
Well, our understanding is the ventilators that we have was of the type that we're looking for range between 10 to 20,000 US dollars. Now, we believe the solutions that we would have will be significantly cheaper than that, and we believe that we'll be making a world-class product. We do understand that because of regulatory requirements, we need to start working before we run. So that is our purpose. We believe ours will be competitively priced.
Well, that's certainly good news for our health system, which, as we know, is anticipating a spike in COVID-19 cases in the next few weeks. Thanks very much for joining us there. Denel Dynamics CEO Sello Ntsihlele joining us there via our Zoom line, as that company now moves from manufacturing weapons of war to actually producing a fit-for-purpose, low-cost ventilator.